Once again welcome to the session. In this session we will be continuing our previous session topic, that is introduction and definition, basic definitions of pharmacokinetics. So, let us get started. Once again I would like to give you in basic introduction of the topic, that the duration of a drug therapy, basic introduction of pharmacokinetics. In last session we have discussed about various processes involved, the various processes like absorption, metabolism, distribution and excretion. All these processes we have discussed and the basic relevant definitions of these processes we have covered. So, now after understanding the basic terminologies which are including in pharmacokinetics, we will start about different duration of action or therapy, how it is affecting the drug therapy or drug performance in the body. So, the duration of a drug therapy ranges from a single dose of a drug taken for relieving an acute condition such as headache to drugs taken lifelong for chronic conditions such as hypertension, diabetes, asthma or epilepsy. So, in pharmacokinetics basically we are observing drug body processes on the drug performances. So, if we talk about that therapy which includes a simple acute activity, acute condition, acute responses like headache and all, and fever and pains. So, from that particular the drug which are used for severe conditions like hypertension, diabetes, epilepsy and all. So, we just study the drug performances on these biological processes known as absorption, distribution, metabolism and excretion. So, the study involves in pharmacokinetics. Now, the frequency of administration of a drug in particular dose is called dose regimen, right. How many doses required to show the peak concentration and on the onset of action to show its desired effect. For example, you say that paracetamol tablet, conventional tablet if we talk about, will be given after every 4 to 6 hours as SOS whenever required as per the registered medical practitioner prescriptions. So, basically the frequency of administration of a drug in particular dose is called dosage regimen, right. Depending upon the therapeutic object to be attained, the duration of drug therapy and the dosage regimen are decided. So, based on what type of treatment you required, what type of condition is there, then what type of dose, its potency and its efficacy will be analyzed and dosage regimen will be defined. Some drugs are given in single dose in a day, and whereas variety of drugs are given in 6 hour duration frequency. So, based on the type of therapy and the nature of drug and its T half and all biological effects and bio availability, the dose regimen are decided. Rational and optimal therapy with a drug depend upon how the therapy is designed. Basically, it depends on 2 points: choice of a suitable drug, what type of drug you are choosing, balance between the therapeutic and the toxic effects. Yes. So, in allopathy we know that the side effects may occur when we are giving the dose, but we always calculate the benefits out of that side effects. Yes. So, it will be like we give weightage to the benefits of a drug and ignore the minor side effects of the drug. Although we can set up the alternate therapies to reduce the intensity of those side effects, but obviously we see the benefits of that particular medicinal agent on the body. Both the therapeutic and toxic effects depend upon the concentration of drug at the site of action, which is difficult to measure. However, it corresponds to a specific concentration of drug in plasma which can be measured accuracy. measured to accuracy. So, basically the therapeutic effects needs to be considered while designing dose regimen and therapeutics index, and toxic effects can also be not avoided. So, on depending on the concentration at the site of action required, we just calculate the drug required for effective use. The drug fails to slow therapeutic response below minimum effective concentration. Those drugs which fails to show therapeutic responses below minimum effective concentration precipitates adverse reactions when above toxic levels. Yes, of course, why we have set MEC, MSC and toxic levels, because below and above them, if it is below, then it will not show any effect. MEC, minimum effective concentration, if the concentration of drug is below minimum effective concentration, it will not give or show any medicinal effect to the body, and if it will be like above MSC, maximum safe concentration, then that means it is reaching towards toxicity level and it will show adverse reactions in that case. The ratio of maximum safe concentration to minimum effective concentration of the drug is called therapeutic index. So, we need to set a dose of a drug between the MEC and MSC levels. So, that particular window is known as maximum minimum effect therapeutic index. You understand that what I am trying to explain, that we see that this is MEC, this is MSC, below this MEC minimum effective concentration no effect will occur, and above this toxic effects will occur. So, this is known as therapeutic index. This window is known as therapeutic index. So, thus in order to achieve therapeutic success, plasma concentration of a drug should be maintained within the therapeutic window. For this, a thorough knowledge is needed to understand ADME. Now, I hope you understand what is the significance of studying absorption, distribution, metabolism and excretion processes. That means, pharmacokinetic study is important to set a dose regimen or therapeutic index of a drug, as well as the kinetics of these processes, that is ADME, pharmacokinetics, right. So, plasma drug concentration time profile. So, first when we see various parameters, like, so how we identify different processes like absorption, distribution, metabolism. So, we have several profiles, we can observe parameters, different parameters, and we can analyze that the drug is going through this phase and giving this much response, analyzing body profiles, like we can collect body samples like urine, blood, right. So, through these body things, we can identify or observe the drug performances. A direct relationship exists between the concentration of a drug at the biophase, that means the site of action, and the concentration of drug in plasma. Two categories of parameters can be evaluated from a plasma concentration time profile. Plasma concentration, that means now we are taking how much drug is reaching to systemic circulation, or we can say the blood component or plasma. So, plasma concentration after reaching to plasma, only after that the patient will get the desired effects, pharmacokinetic parameters and then pharmacodynamic parameters. So, a typical plasma drug concentration time curve obtained after a single oral dose of a drug and showing various pharmacokinetics and pharmacodynamic parameters is depicted in figure. So, figure will be in the next slide. So, such a profile can be obtained by measuring concentration of drug in plasma samples taken at various intervals of time after administration of a dose. So, this type of profiles can be obtained after at various intervals after time after administration of a dosage form, and plotting the concentration of drug in plasma, y axis, and versus corresponding time at which plasma sample was collected, x axis. Now, I feel that this figure will tell you everything about how we can correlate pharmacokinetics and pharmacodynamics to set the drug efficacy and safety. Yes, consider it the plasma drug concentration. This y axis is plasma drug concentration and this is time, x axis time. For example, a patient is given one tablet, right, one tablet, and the tablet is the given tablet point is this, right. So, after that onset of action, after few minutes the patient the tablet will disintegrate, dissolute, and then it will reach to that particular state to get absorbed from the body. Understand? That means, if a patient is taking medicine, first the tablet will get disintegrate, will break down in small particles, and then will dissolute. That small particle goes to a dissolution media or the body medias, and then the unionized form of a drug or unchanged form of a drug will get absorbed in the blood circulation. So, that time you need to consider for that particular process is disintegration, dissolution, and then ready to be absorbed. This is known as, this point is known as onset of action, that from this point the drug is getting absorbed, and this C max represent the maximum concentration of drug in the body plasma or blood plasma, right. So, after this you see that C max, this is known as absorption phase, and then post absorption phase. That means, now the drug is not absorbing that much, but eliminating through the system. So, this point is known as C max, maximum concentration. Okay. Now, absorption rate is equal to elimination rate. That means, the drug amount which is absorbing is equal to the drug eliminated through the system. Now, this basically it is a intensity of action, how much the peak of peak concentration you are getting is give you the idea about intensity of action. So, now if we talk about the downfall line, this will be like minimum effective concentration. This from the onset of action point, the point that means the drug start giving its effect, right, in the body. So, that means minimum effective concentration will be reached, and then this is maximum safe concentration, this area. Now, the range between these two will be considered as therapeutic range. Now, at this below that particular minimum effective concentration, that means we are not getting any medicinal effect from the drug. So, it will be termed as termination of action. Subtherapeutic level, below that MEC level, it will be considered as subtherapeutic level, and then elimination phase. Below that MEC, the drug fate is like eliminating through the system, and only elimination will occur, and this will be considered as elimination phase, and the blood reaching to C max point, and at this point of time it will be termed as T max, and all these curvy area will be called as under the area curve, and this will give you the exact profile of the drug performance in the body systems. I understand, I hope you understand this thing. So, once again I will repeat. So, this is basically the absorption phase, in which phase, in this phase the drug is getting absorbed and reaching to systemic circulation, and this point of time C max will represent the point of the highest plasma concentration of drug, and then after reaching C max, and the time at which it is reaching C max will be called as T max, and post absorption phases like it is the elimination will be more as compared to absorption, understand, and then below that MEC point it will be like subtherapeutic level, and at this point of time drug will show no effect to the body receptors and the start getting eliminated through the system, and the termination of effect will be will occur. So, this is the plasma drug concentration time profile. That means, after 15 minutes what will happen to the drug, after 30 minutes what will happen to the drug. That means, the pharmacokinetic behavior will get changed time by time. If you see, the drug is initially taken and after 15 minutes onset of action will occur, absorption, elimination, termination and all these things. So, through these plasma concentration time profile, we can observe how the drug is behaving within the body. Pharmacokinetic parameters. Pharmacokinetic parameters, the three important pharmacokinetic parameters that describe the plasma level time curve and useful in assessing the bioavailability of a drug from its formulations, right. So, how we assess the bioavailability of drug, that means, if we say that the drug bioavailability is 50%, 60%, 80% through this route of administration, how we can assess? Through this plasma concentration time profile curve. Now, the point of maximum concentration of drug in plasma is called as Cmax, and I told you just now. So, this is peak plasma concentration. It is also called peak height concentration or maximum drug concentration. So, Cmax is expressed in microgram per ml. The peak plasma level depends upon dose administered, how much dose you are administering, right. In case of higher dose, the Cmax will be high, and in case of lower doses, Cmax will be low. Rate of absorption, at which speed, at which how much time it is getting absorbed, and it also depends on the physicochemical properties of drug. Rate of eliminated, yes, how it is eliminated, in how much time it is getting eliminated from the system is also important. Sorry. The peak represents the point of time when absorption rate equals to elimination rate. These points I can show you that absorption rate is equal to elimination rate. You see Cmax, and the point of time is known as Tmax, maximum time, right. So, absorption phase, the portion of curve to the left of peak represent absorption phase, that is when the rate of absorption is greater than the rate of elimination. So, in this part of the curve, the rate of absorption will be high as compared to rate of elimination of drug. That means, the rate the drug will not that much eliminated, but the absorption is higher. Now, the section to the curve right to the peak generally represent elimination phase, that means, this part. So, this is post absorption phase, elimination phase we can say it, in which absorption is very less, and then elimination will be high for the drug component, when the rate of elimination exceeds the rate of absorption peak. So, this is elimination, when the peak concentration is often related to intensity of the pharmacological response. The more the intensity, the better the pharmacological response of drug. So, above minimum effective and maximum safe concentrations. Time of peak concentration, Tmax, the time for drug to reach peak concentration in plasma after extravascular administration is called time of peak concentration. That means, from the plasma and moving to the extravascular tissues or cell, the drug at which time is known as peak concentration. It is expressed in hours and is useful in estimating the rate of absorption. It is very important in how much time the drug is reaching to the highest point, peak point. Onset time and onset of action are dependent upon Tmax. Yes, of course, it can be correlated with that particular maximum time concentration. The parameter is of particular importance in assessing the efficacy of drug used to treat acute conditions like pain, insomnia, which can be treated by a single dose. So, Tmax is important parameter. Area under the curve, AUC, it represents the total integrated area under the plasma level time profile and expresses the total amount of drug that comes into systemic circulation after its administration. That means, it is a total area under the curve, which representing the total amount of the drug comes to the systemic circulation once it is administered. You see, this total area is AUC. Okay. Yes. So, AUC is expressed in microgram per ml into hours. It is the most important parameter in evaluating the bioavailability of drug from its dosage form. Yes, you see we can observe Cmax, Tmax, onset of action, elimination point, MEC, MSC. So, through this parameter we can analyze the drug's bioavailability and through its absorption pattern. AUC is also important for drugs that are administered repetitively for the treatment of chronic conditions like asthma and epilepsy. So, it is also useful not only for single doses, for multiple doses as well. You see concentration versus time profile, all the three parameters are highlighted here. AUC, this curve represent AUC, this is Cmax, this is Tmax. So, this x axis shows time profile time, and this is concentration, plasma concentration, Cp, plasma concentration of drug. So, after that, linear non-linear pharmacokinetics, as we are discussing the basics of pharmacokinetics. So, when the doses are increased for most drugs, steady state concentrations increase in a proportional fashion, leading to linear pharmacokinetics. So, when the dose higher dose are set for most of the drugs, steady state concentration increases in proportional fashion, leading to linear pharmacokinetic. That means, in this case a single dose we see the curve like this, but for higher doses it will be like steady state curve. When steady state concentration change in a disproportionate fashion after the dose is altered, drug is said to be follow non-linear pharmacokinetics. It is a type of standard pharmacokinetics a drug is following the process, but when it is not following the process due to its disproportionate fashion, so that means it is following non-linear pharmacokinetics like this. So, for identifying non-linear pharmacokinetics, basically Michaelis-Menten equation states several basic fundamentals about non-linear pharmacokinetics. This graph represents, this is the steady state concentration milligram microgram per liter, and this is the value, and this is the profile of drug saturable protein binding or autoinduction. Basically, protein binding will occur after plasma concentration in distribution phase. So, this graph represents the linear kinetics of a drug, and the deviation is basically can be calculated through Michaelis-Menten equation. So, these are the references you can see from which I have prepared the data, and I hope you are fully able to understand the basic pharmacokinetics definition and introduction. So, thank you for watching.